Hey guys, Dr. Martin Hart here. Today I want to talk a little about the dreaded Herxheimer reactions. Okay, so I've entitled this one, What the Herx? So when somebody's herxing, what do they typically mean? Well, they typically mean they're having some sort of a reaction to treatment that feels terrible. But a lot of people don't really know the difference between the different types of reactions they're having. So a Herxheimer reaction is a reaction that happens due to bacterial die-off. Sometimes it could be due to the endotoxins that are happening, but more often it's just the bacteria are dying off. And then the immune system has to go clean it up, which creates lots of inflammation, and that is the Herxheimer reaction. So the Herx reaction typically happens with spirochetes, but it can happen with other types of bacteria, but it's just an immune inflammatory response to those bacteria dying. So if you take some herbs or something like that, or antibiotics, and the bacteria die, then the immune system has to go clean it up, and the immune system uses inflammation to do that. So if a lot happens all at once, that feels terrible. But there's other types of reactions, and people use the words Herx often. They do a little bit of detox and they say, oh, I'm Herxing. Well, that's not actually a Herx response at that point. It's a detoxification response, right? So a detoxification response is not necessarily microbes dying, but you might be dumping heavy metals from the cells or tissues. You might be having some mycotoxins from mold coming out, or just some general toxicity coming out, and then you can't clear them fast enough. Your body can't clear and neutralize them fast enough, so it feels pretty gross. It feels pretty detoxification like that. Also looks like flu-like symptoms because all that stuff is coming out and you can't clear it, or hangover-like symptoms, right? So that's a detoxification reaction. Then we have Candida die-off. So when Candida, that yeast, when it dies off, it will have multiple things happen. Number one, it releases acetaldehyde, which is the same thing that makes us hungover from too much alcohol. Okay, so that feels terrible. Candida will often hold heavy metals like aluminum, so we'll release that, and that'll feel pretty bad. And then it has just its own sort of Herxheimer reaction from the inflammatory response and just other general toxins that might be living inside that Candida biofilm. So that's kind of what I call the Candida hangover at that point. Really important that you take good toxin binders and anti-inflammatories when you're dealing with Candida. Now, parasite die-off is pretty similar to that, right? So parasites will hold heavy metals and toxins for us. So if we kill them, they can have a big release like that. But then parasites can also have other bacteria and viruses that live inside them. So you might get an acute kind of almost like infection from killing the parasites because they're dumping their infections into you again, and then they're going to dump their heavy metals, and then again another inflammatory response from them dying and the immune system having to clean it up. So that can almost be like a parasite Herxheimer sort of way. So again, with that one, you have to address each one of those issues in order to feel a little better and make sure the treatment's flowing in the right way. Mold, a lot of times when mold is getting a mold reaction or mold is getting cleaned out, people can have what's called a Sears response or chronic inflammatory response syndrome. Same idea. That's the immune system trying to deal with it, having a massive inflammatory response to it because it can't clear it well. Okay, so what do you need to do if you're having one of these, either die-off or Herxheimer or detox reaction? Well, there's a couple options you can do here, okay? Number one, you always want to talk to your doctor about your treatment protocol. So discuss with him what you need to do, what's going on, so you guys can figure that out. Because you don't want to have a Herxheimer reaction or a detox reaction. You want to try to keep that from happening. And a good clinician will always do their best. Now, you can't always avoid it, okay? But you want to do your best to mitigate it as best you can. So number one, you want to keep your detoxification pathways up and running, right? You want to make sure you're staying hydrated so you can flush it out. You want to keep your bowels moving. You want to be sweating so you can get that stuff out and clear and open, okay? You want to take some toxin binders. You know, if you're going to go clean up your house, you don't just dump it on the floor. You want a garbage bag to put it in. And so those toxin binders for us are like a nice garbage bag, okay? So we want to take toxin binders. If it's an inflammatory response, we can look at some natural anti-inflammatories. Some different ones that you might see my patients using are curcumin or fish oil, black seed oil. All those are fantastic anti-inflammatories. Sometimes I'll have them use proteolytic enzymes if that makes sense, but you also want to make sure that's not going to open more biofilms for you. So that just depends on a case-by-case basis. If there's a big detoxification reaction and we need to deal with more of an antioxidant side of things, vitamin C is an easy go-to. Resveratrol is a great one. Molecular hydrogen is a really, really potent antioxidant, anti-inflammatory mitochondrial booster that we use, and so that one's fantastic. If well tolerated, you could use NAC or glutathione for those antioxidant detoxification type reactions. That really cleans up. But again, it's got to be well tolerated for you. And of course, you want to take your electrolytes because those are going to get used up a ton in any type of these processes. But you always want to make sure you're replenishing your electrolytes, as I say. So, guys, you've got the Herx reaction, you've got detox reactions, you've got Candida die-off, you've got parasite die-off. You want to kind of have a good idea of what you're dealing with so you know how to respond to it, and then you can use those steps. If you've had some sort of a treatment reaction, put what's worked for you down below just so people can get an idea of what everybody else is using. If you have any questions, please feel free to reach out and share this with anyone who you think might benefit. Thank you.